and welcome to Senior Moments. I'm Jackie Sibley Newton, your host. This is a broadcast service of Cleveland Community College on C19. You can view it on c19.com as well, and c19.tv. And we hope that you do share that link with friends and family as well. Today, my guest is Monique Brown. She is the clinical advisor or clinical account
executive
manager
yes.
for Carolina Home Care.
Yes, yes.
And I don't know a lot about clinical account managers at Carolina Home Care, so I'm delighted. I know that we had worked together on a referral that you were looking for assistance, so I know that you work with Medicaid residents and patients, as well as probably private pay.
Yes, we do, commercial and of course Medicare.
Okay.
Yes.
So tell me a little bit about Carolina Home Care and what you do.
Oh, all right, awesome. Well, I'm the clinical account executive for Carolina Home Care, and we are located in Rutherford County, but we do cover Cleveland County. We cover Burke County. Anybody that has any needs in those areas, of course, we can take care of them. We cover occupational therapy, physical therapy, and also nursing and speech therapy as well.
Okay.
And for me, it holds dear to my heart because I am a physical therapy by trade. So.
Okay,
yes.
so you had a physical therapy background.
Yes, ma'am.
And did you start with Carolina Home Care as physical therapy?
I did not, but I have worked for a home health agency in the past, and I did do clinical work. So therefore, I really know the need for home health.
And do you do the assessments in the home?
I do not. We do. I set up sometimes fall screenings and things like that for patients. Well, sometimes facilities. We come in and set up, screenings, blood pressures, things like that to see the need, because we offer a lot of different programs. And so therefore, doing the screenings, we can decide what the patient needs. And of course, if the doctor recommends something that the patient needs, definitely can get out to see them.
Okay. So let's start with, let's say, someone is at home and the family members think, oh, we need some help.
Yes.
So do they contact you? Do they contact the doctor and get a referral?
They contact the doctor and they get the order, and then the doctor will then send the order to Carolina Home Care.
Okay.
And normally if the patient tells the doctor we are the home health agency they would like to use, at that point, then the doctor will know to send it over to us.
Okay.
And then after that, I'll do the legwork. I'll go to the doctor's office if I need to pick up the order, if I need to pick up any kind of paperwork. I contact the patient, especially if the patient's at the hospital. I go visit, let them know we're coming out, who's coming out, when, kind of let them know the process and how long it will take that first visit. Just kind of, let them know that we're going to take care of them.
Okay.
Give that reassurance.
So give them kind of the overlay.
Yes.
This is what it's going to look like. This is who is going to come. Now, if they have an order for physical therapy and occupational therapy, are there two different therapists that are going to come out at two different times?
Yes. Yes,
Okay.
they'll come out at two different times, and usually they'll call the day before and let's set up that visit. But our office does call the patient as well and let them know who's going to be coming out to see them, so they're not, when they get that call, they're not surprised. Okay. So then the PT and OT will then call, schedule that time and visit for them to come out to see them.
Okay. And for some people may not know, what's the difference in physical therapy, occupational therapy? Speech therapy is a little bit, you can kind of tell that's a little bit different. But physical therapy and occupational therapy, a lot of people have questions about what's the difference there?
Well, the difference is with occupational therapy, usually they're going to work with the upper extremities, and they're going to sometimes work, most time, all times, work with ADLs, like things that they want to get back to used to doing. It's safe in the showers, transfers, even brushing their teeth, combing their hair, things that they're not able to do.
Very specific things.
Yes, due to a shoulder surgery, anything that could have happened that upper extremities, they will work with that.
Okay.
And so PT is more lower extremities, gait training, balance training, endurance levels, those are the things that we work on, especially if the patient's had a knee done or a hip, we're going to go out and get them moving again as soon as possible, of course, after surgery. But those are the things, that's kind of the difference in a simple way.
Yeah.
More in depth, once we get out there, but most of the time, which it kind of, sometimes some of them can go hand in hand as far as transfers.
Right.
OT and PT can work on that.
Yeah.
But for the most part, we're going to be working on gait training, lower extremity muscle strengthening, getting them safe in the home. I think OT and PT both do that, getting them
Yeah.
safe at home again, so they can be at home.
And I try to tell people things like, if you are having trouble picking up your fork to eat, that's an occupational therapy thing.
Yes,
Because that's a
yes.
specific movement that you need help with.
Exactly.
Where if you're trying to go from using a wheelchair back to using a walker,
Yes.
you're
That's
going to need that
physical
therapy for
yes,
that.
that's
So
correct.
I help
And
them
also we
understand.
help with equipment. So if a patient needs to be wheelchair sized or walker, things like that, and adaptive equipment to eat with. You know, sometimes they need adaptive equipment, you know, just because they're not able to hold the spoon like they were before. Just going in and assessing those needs to what the patient
Right.
needs.
And helping them stay independent.
Yes, and stay
Sometimes
at home.
just that equipment, they can still feed themselves. They just need a special spoon and fork to do that,
Exactly.
or a special cup.
And that's been limiting them, you know, they're not able to feed themselves, and like, what's going on? So we come in and assess those things and then get them back feeding themselves again. And
Yeah.
it's just like those simple things to us.
Right.
But it's really not simple,
Right.
and they're just so ecstatic when they're able to do things on their own again,
And get
able to
back
be
to
independent
that.
again.
And then speech therapy, a lot of people say, well, I'm speaking fine. I don't need speech therapy. But it goes much further than that.
Yes,
a lot
it
of people
does.
don't realize.
It
It can
does.
be as simple as maybe you just got new dentures and things aren't
Yes.
working
Exactly.
correctly. And speech therapy might help with that.
Exactly.
Or the swallow test.
And the swallow test, yes. Those are some of the big ones that speech works with. And they also work with cognitive levels, word finding, things like that. So I think sometimes they forget with speech, because occupational therapy can work on those things too, but speech is, I think they're more prone to work on those things with patients.
Yeah.
So it does go beyond just swallowing and eating. It goes with cognitive, like I said, memory, active mind, things like that too.
Yeah. So, what kind of other things does Carolina Home Care do? Are they strictly the in-home therapy?
Yes, yes,
Okay.
strictly in-home therapy. Again, we do wound care as well, so we work really
Okay,
close
that
to
was
the
the
wound care
question.
doctors with nursing care. So we have a whole lot of different, well, not a whole lot, we have a lot of different programs that, of course, fit the patient's needs. We have our Clearway program, which is our chronic lung disease program. So we have the Venture Care program, which is our congestive heart failure program. We have a fall program, balance, orthopedic, respiratory.
Oh,
We have a
okay.
lot of different, and then we also have two awesome DPTs with their doctorate PTs that specialize in vestibular care. So we've been actually working with ENT Carolina on some patients. They're having dizziness, not able to drive anymore. So we also been working with those patients as well.
Okay. So, if someone is having a specific issue, is there an age limit? Do you work with only seniors, like they have to be 65 and older, or
No, we
any
don't.
age?
They can. We've had patients. I think the youngest I've seen are in the 30s. We have. It just depends on the insurance.
Okay.
And we and a lot of insurances that we accept, I know a lot of others don't. So we do have some options. It's not just the 65 and older. So yes,
Okay.
we do.
So anyone who has a specific need and needs assistance can contact you and see what kind of programs they assess for.
Yes.
But they would still need to assess that through their doctor or get that
Yes.
order through their doctor. Okay.
And even if the doctor can make recommendations on what the patient needs for home care, he just needs to write that order and send it to us. And again, I have even gone by doctors' offices and picked up orders and took it to the office, whatever it takes to make it easy for the patient and easy for the facility or the patient at home, so we can get them started and get the care that they need.
Well, let's talk a little bit about those specific programs and how someone gets involved with those. Let's say they're a heart patient, they have a heart condition. So what would that program look like for them?
Well, they would go out we would bring a scale out, of course, and blood pressure cuffs, so we can make sure we have their their blood pressure and make sure the heart rate and all that good stuff, making sure we're weighing them. So, you know, if they are gaining weight, we can know what's going on, especially with the congestive heart failure. So that's very important to keep that weight and report it to the doctor. We give the doctors patient status updates. So if there's things going on with the patient, we let the doctor know. So the patient doesn't have to, and keep the patient out of the hospital as well. So we make sure we're getting out to see that patient twice a week. And sometimes it may be 3 times a week, but most times twice a week, and checking that patient and having the patient, teaching the patient how to weigh themselves and or a caregiver, how to do their blood pressure and things like that. And then they can report that to us, so we can report it to the doctor, or we can check in with the patient, and they can call us 24 hours a day. They can give us a call. There's always an on-call nurse that they can contact. So again, we can keep them out of the hospital and meet their needs, do some preventative measures.
Okay. And are you in communication with the physicians as far as the medication changes, and is it a joint thing where you're in communication, you know what medications are changing, or you can even say, hey, we're noticing a lot of weight gain, there's some fluid buildup, there may be LASIK needs to be changed, or there needs to be something done.
Yes, and usually with the LASIKs, whenever we have the patient weigh themselves, we report that to the doctor, and they may change the dosage that day, and then we call the patient and instruct them what to do, how many to take, and that. So we work really closely with that as far as LASIKs and keeping their weight down and making sure, again,
everything's being monitored.
Yes,
a little bit
monitored.
more
Yes,
closely.
exactly.
Okay.
Yes.
And then,
I'm sorry, what was your second question?
I think we covered it.
Okay.
I think.
Okay.
So, what are some of the other programs that you have?
We also offer our balance program, which you know, patients have all those rugs in their home and
all the fall hazards.
Yes, all the fall hazards. So we go into the home, assess the home, and give the patient recommendations on safety measures, and of course working on their balance. We have a thing called an AirX pad that we put the patients on to test their balance, and you know, and we have really good outcomes from that. When, of course, uneven surfaces, having them walk outside, things that they used to do that they're scared to do now because of all the falls.
Right.
So we definitely try to keen in on things that they used to do and want to get back to doing. We have patients out in the garden, you know, that's their therapy session that day, working and pulling whatever they're doing out in their garden. Just trying to get their balance and getting them back to, you know, being functional.
Things that they love.
Exactly.
Right.
Exactly. And with the vestibular program, we have patients that can't drive because they're dizzy. And so with us working on that, they're able to drive themselves to the doctor, or the grocery store, or church, or the hair appointment. You know, that's very important.
Well, driving is a big deal because you lose your independence.
Yes.
And so keeping that as long as you can and not having to rely on somebody else.
Exactly.
That's a huge, big deal.
Exactly. So whenever we see the outcomes from that, it's amazing. It's amazing because the patients are so grateful just to be able, because we had one patient that said that she was dizzy. She's been dizzy all her life. You know, that's just something she's always had to deal with. And since Dusty's been working with her, our PT that I was speaking of, she's able to get up without feeling, she said she would have to sit on the edge of the bed at least 20 to 30 minutes before even starting her day. So for her to be able to even set up and get going and start her day without the dizziness, she just thought that was amazing.
It's life-changing.
Yes, and I got to witness her telling the story, so that was such an amazing story. And she was so grateful.
So lots of different programs that help in the home and help with patient care and communication with the doctor, communication working with the family, working with the power of attorney or whoever their responsible party is as well, and involving them in the care.
Yes. Yes.
And if they have a caregiver that comes into the home, are they part of this plan as well?
Yes, they definitely are. Especially if it's a teachable caregiver. We try to, if the patient has wound care, because we don't come every day. So on the off days, we would like the caregiver or the family member, anyone that we can teach, and we actually educate them and have them show us, how to do it to make sure it's done safely and done correctly. So we always try to make sure we do that. So I think, the caregivers are very involved in it, and family members. And most of the time with our geriatric patients, those are the patients that we're talking to, or the family members that we're speaking with.
Helping, Well, we're going to take a quick break, and then we'll come back and learn more about Carolina Home Care.
Education is our most powerful tool to improve and change our world. Hi, I'm Rhonda Benfield, your host for School Matters. Join me for a new program every other week with information from and about the students and staff of Cleveland County Schools. Discover what our schools are doing to challenge students and help them reach their full potential. You can catch us on Spectrum Cable Channel 19 or stream us live on c19.tv.
Today I'd like to make everyone aware of the risk of skimmers. First, let me tell you what a skimmer is. A skimmer is a device that is often installed at a gas pump that is used to steal credit card information. When you use your card at the pump, a skimmer is disguised to look like a card reader and collect both card and PIN numbers that can be used to replicate and create counterfeit cards. Now let me tell you some of the best practices to protect yourself from skimmers at the pump. Always ensure that the tamper tape at the pump you're using is intact. Skimmers are installed inside the pump housing, and this tape ensures that the pump has not been opened. Always try to use the pump closest to the entrance to the store. Skimmers are often installed at the pump furthest from the store and the camera systems. Pay inside whenever possible. Cover a pin pad when entering your PIN number to protect against pinhole cameras.
Hi, welcome back to Senior Moments. I am Jackie Sibley Newton, your host, and we've been talking with Monique Brown of Carolina Home Care.
Yes.
Now, when someone wants to sign up, we've got the referral from the doctor. Will you contact the family once that referral comes through, or does the contact come from the family first?
Usually we contact the family
Okay.
and we let them know we received the referral and let them know when we're coming out to see them. And usually whenever the doctor sends over the referral, the insurance information is usually on that. And we, of course, verify the insurance, make sure we're in network. And then we then call the patient and set up services.
Okay. So when they contact you, you've already verified with insurance, gotten the pre-approval. You do accept Medicaid, Medicare,
Yes.
and most insurances.
Yes.
So they're going to already have all of that information. There may be questions because sometimes all of that doesn't come through
Yes, that's
clearly.
correct.
So,
Yes.
so the family should have that information handy.
Yes.
They need the patient's name, date of birth, those standard things that you're going to have.
Yes.
Forms that they're going to need, like medication lists, and there's forms that we call FL2s and
Yes.
H&Ps, things like that. That's generally going to come with a referral.
Yes.
Are those things that the family needs to chase down, or are those things that you're going to get from the physician?
Those are things I'm going to get. The
Okay.
family won't have to do anything. Once the doctor has sent over that referral, they will not have to do anything.
Okay.
We will take care of the rest. And again, I will we will have the medication list, but when we go out to the home, we also check again just to make sure everything that's on that list is accurate. Because sometimes we get out there and patients like, oh, I'm not on that anymore. Oh, I don't take that anymore.
Yes,
So-
we hear that a lot.
Yes,
Yeah.
so we always make sure everything's accurate, and then we notify the doctors, especially if it's something they're not taking anymore and the doctor thinks they're still taking.
Yeah.
it.
And
So-
it's always good to have those prescription bottles, have everything out so
Yes.
that they can compare.
Yes.
Because maybe your prescription bottle says 100 milligrams, but that doctor's order is 125 milligrams.
Exactly.
Or it's supposed to be cut in half.
Exactly.
Or, so
Or they have
especially-
ibuprofen and they think, oh, that's not a med. I just take that one.
Yeah, anything over the counter
Yes, it
may
has
not be
to
on
be.
that list, and it
Yes.
has to be on the list.
Exactly.
Pepto-Bismol has to be on the
Yes,
list.
yes, exactly.
Ibuprofen has to be on the list.
Exactly.
That Aspercreme you're rubbing on needs
Yes,
to be on the list. Yeah, everything is
Exactly.
considered a medicine. It has to be
Exactly.
on
And
the
I think they
list.
forget about what they probably think, just because it's over the counter, they don't need that. But
Yeah.
we go, like I said, we go in the home and we do ask them those questions because they do forget because they think, oh, I bought that over the counter. I don't need to put that on the list.
Right.
So-
I only take that Sudafed when my allergies are bothering
Yes,
me. Well, it's
exactly.
important to know.
Exactly.
Especially if you're a heart patient.
Yes.
Or
Because we do the med interactions to make sure everything's in coordination with each other. So,
Yeah.
yes.
So you have to know what somebody is on, especially if there's any kind of interaction while they're in therapy,
Yes.
you need to know, what did you take today?
Exactly, because those are going to be the questions if we do have to send the patient out to the hospital or call the doctor and let them know the episode, the medication has to be correct.
And if there is sudden weight gain or change, then
Yes.
what's happening?
Exactly.
What's going on?
And again, with the meds, something is really important if they're having PTRNRs, if they're after surgery, for them to check that so we can make sure we tell them the right dosage to take throughout the day. So that's very important. So we will be in contact with the patients about meds, but those are so important to have that
Yeah.
communication.
Now, is that something else that maybe that you do as part of the assessment, is look through those medications
Yes.
and see, because sometimes people see a couple different doctors and maybe those medications haven't been really evaluated.
Yes, that is the number one thing that all disciplines do when they come in the home. Each discipline has to check the meds when they come in the home. That whether it's OT, speech, nursing, of course nursing would anyway, but all disciplines have to check that meds to make sure that they match, because they may have told nursing about something and then PT, they may haven't told nursing about it. And then PT goes out and, I forgot to tell her. So it's good to always ask, I need to see those
Yeah.
meds, anything you're taking, because they do forget.
And we find too that if a resident is going to a pain clinic, maybe their medical doctor, their primary care, didn't know that.
Yes, exactly.
And they might be on a medication that somebody didn't know, maybe the communication didn't make it.
Exactly.
And they didn't know. They could be on a medication that they're either prescribed twice or it interacts with something else that they're on.
Exactly.
And I know in the home that gets missed a lot.
It does. And we've had medications that interact with each other.
Yeah.
And so we have to call the patient, call the doctor, so those things are important. So, it could be crucial.
Especially with falls.
Yes.
Maybe that medication is causing that dizziness or causing those falls. Because
Exactly.
they're making them lethargic. We didn't know that that's what was happening.
Exactly. And again, as a treating therapist, when I was out in the field, I had a patient that every time I got out, he would get dizzy. And every time we'd stand up, he'd get dizzy. I'm like, what is going on? So at that time, I called the doctor. He had left from the hospital, same medications, but couldn't get out of bed, could not get out of bed. And called the doctor, and the blood pressure medicine, he didn't need it anymore, had been on it all his life. And so he kept taking it, and he didn't, and so his blood pressure was bottoming out, and he had no idea.
Yeah.
And once they took it off of him, took the blood pressure medicine away, he was up walking, and it's just
Makes a
miraculous.
world of difference.
Yes.
And those are things that you really don't know until you start working one-on-one with someone, because your doctor might see you once a year.
Exactly.
Maybe
yeah.
once every 6 months. They're not in the home like that. They're not going to see these things. It's going to be a little
Exactly.
different.
Exactly. So that's why I think home health is so important too, because we're there, we see these things. And so we
Exactly.
can report back to the doctors, because again, they may not see the doctor to 6 months or a year down the road. So
Exactly. Exactly.
So these are things that we can, again, preventative measures.
Yeah. Even for a referral for a short period of time. Now, how long typically do you work with residents or with people in their homes?
Usually we try to see them at least for 30 days. We're during our 30-day span. And then if they need to be reassessed, we reassess them, and then we may continue on seeing the patient depending on their need. Some patients that we have a knee or a hip or shoulder, we may only see them 2 to 3 weeks, and then they're going outpatient. So that surgeon wants them to get to outpatient, just getting them started, getting them moving, and then getting them to outpatient services. But some patients that need our services a little bit longer, someone's had a CVA, a stroke, that may need us a little bit longer. We may be in over a month to seeing that patient and getting them moving. And I have a story with that as well as a treating therapist. I had a patient that just, him and his wife both had just retired and they were getting ready to start traveling. He was only in his early 60s, had a stroke, and it was just a terrible situation. She was a teacher, and I think he worked for the city over 40 years. It was a really sad situation. But when we finished, when we started, he couldn't even walk. When we finished, he was walking, he was driving his truck again. It was amazing.
Oh,
it was
wow.
amazing. So I know home health works. I know it
helps.
does. Yes, it does.
We want people to be able to contact Carolina Home Care if they have any other questions, and your information is on the screen.
Yes, yes.
So please contact Carolina Home Care with any questions that you have. You can also contact me at Tarabella anytime you'd like, and I'd be happy to answer any questions that you have about any guests that we have on the show. Thank you so much for watching Senior Moments. Thank you, Monique, for being a guest today.
Thank you for having me. I really appreciate it. Thank you for this opportunity.
Thank you. And we'll see you again next time on Senior Moments.